Since 2007, when the subprime financial disaster hit full steam, millions of properties across the United States have gone into foreclosure. That's thousands of properties a day, day after day, week after week, month after month for years. And we all know about the economic catastrophes that spawned, but now it's become clear that the subprime implosion also has wide-ranging health implications. Dr. Craig Pollack at Johns Hopkins Medical School in Baltimore has been the lead researcher in ongoing studies of how home foreclosures actually do impact health. So far, the projects have looked at a population of homeowners who are losing their homes, as well as a national group of mortgage counselors who assist those people. We asked Pollack for an update on what he and his team are doing and why that matters.
We know that disparities are an enormous problem across the United States, with non-white populations and poorer populations being more likely to experience poorer health. We also know that foreclosure disproportionately affects non-white and low-income populations. From a health perspective, we're worried that foreclosure, to the extent that it's associated with poor health, can widen these disparities, making a big problem even worse. However, it's not a problem that's received widespread policy attention, and I think it's important to try to understand the foreclosure crisis as a health crisis. To this point, we've surveyed people undergoing foreclosure, showing that they have high health risks, more likely to be uninsured, very likely to report symptoms of depression, more likely to report not having enough food to eat and not having enough money to go to the doctor. We've also surveyed mortgage counselors, showing that nearly 70% said they think it's their responsibility to help direct clients to local health resources. However, nearly half said they needed additional training in order to figure out what those resources were. Over a third of mortgage counselors said that they had a client in the past month that wanted to kill themselves. We now think it's time to build interventions that test what's the best way to link people undergoing foreclosure and mortgage counselors and public health agencies, so that we're all working together to support the health and well-being of people and their families undergoing foreclosure.